Welcome to Culturally Prescribed. I'm Titus 1K, and this is
Ragab, and this is a conversation between a dentist and a fourth-year dental student.
So what's the first question that you have for me?
Man, I have so many questions for you, man. I'm scared. So let me ask you, when you are at my stage, fourth-year dental student, you got like 7 months till you graduate.
At this stage, fourth-year dental student, a couple months till graduation, I can't necessarily say I was scared.
Okay.
By this time, because it's about 6 months before graduation that you hear about going into residencies and getting accepted. And so by this time, I was just finishing two interviews, and I had another 2. And so at that point, I kind of wanted to go into residency, kind of knew I was going to go into residency.
So you ended up going to residency?
Correct.
Okay. Where at?
So I went to residency in Birmingham.
Okay.
It was it was just outside of Birmingham, Alabama. Mm-hmm. And a smaller residency through NYU. And to me, they did an excellent job. I came out learning quite a bit.
Okay. Then what did you do after the residency?
After residency, that's when I was scared.
Okay.
So going through high school, going through college, going through dental school, you have what's right and you have what's wrong. Okay. If you get it right, you get an A. If you get it wrong, you get an F.
It's very objective.
Correct.
Okay.
But once you leave dental school, once you leave residency, it's now what you want.
You make the treatment plan, what you think is best for that patient, that tooth.
Correct. Even as far as jobs, you can work 6 days a week, you can work 7 days a week. You can work one day.
4 days a week. Some 3 days a week.
Exactly. You can work in one office or you can work in 5.
True.
And so at that point, it's what you want.
That's it. There's no more map.
Correct.
The map ends and you just go. That's kind of why I'm scared, because for me, I'm not going to residency. Okay. Hopefully. We'll see how this COVID-19 stuff goes. But hopefully I'm going straight to work. And I'm trying to move to a brand new city. I'm originally from Jersey. Nice. I've been in Nashville, Tennessee for 3 years, and I just don't like the cold. So I want to move to Florida. So it's going to be a new place, new job, brand new lifestyle, and I'm going to be by myself. Okay. So that's kind of why I'm scared.
Gotcha. Well, that's good reason to be scared.
Right? Where are you from originally?
Where am I from originally? So I grew up in Southern California. Okay. From there, I kind of hopped around. I went to high school in Georgia. Okay. Most recently, I moved to Nashville. So
how long have you been in Nashville?
Been in Nashville about 4 or 5 months.
Okay.
Right.
Interesting. What made you come to Nashville? I'm curious.
What made me come to Nashville? That's a very good question. I would say I didn't like the cold either. Okay. And then I had friends and family this way. Okay. And so before Nashville, I was actually in Chicago.
Oh, that's too cold for me, man.
Chicago's cold. And I also was sort of alone there. So my sister was in Chicago, but she left about a year after I got there. And so at that point, it's just kind of friends I have. And so anytime there's a birthday, there's any get-togethers going on, I have to either drive many hours or fly out. And so I got tired of that.
Interesting. So I lived in Jersey my whole life. I was born in Egypt, and then I migrated when I was 9 months old, and I lived in Jersey my whole life. Been in Nashville, Tennessee for 3 years. Okay. And Florida, I think Florida is my final stop.
Why Florida?
I've been there on vacation a few times. I did a Florida tour where I did a road trip all the way from the west part all the way down to the tip and came back up to the east part. I just like the state in general, despite all the crazy things you hear about it.
I was going to say. So they have, of course, depending on who you talk to, they have different names for different parts of Florida. Mm-hmm. And so I feel that the South Florida is very, very different from, say, the Panhandle, which is very different from the middle of Florida.
True. Very true.
So what part are you looking for?
The western part of Florida. So not the Panhandle, but Tampa, Clearwater, just along that west coast. I'm going to land there initially. Okay. And then when I know more about it, then I'll branch off to the other parts. Nice. So you're a general dentist?
Correct.
Okay, that's what I'm trying to be. Okay. Let me ask you, what's your end goal? Do you want 20 practices? Do you want to move on and do one specific, do you want to place implants? What's your end goal?
Right now, my end goal would be to be happy.
Okay.
To be happy, to be content.
Mm-hmm.
'Cause I find that a lot of dentists either find a job where they make good money, but they don't like what they're doing.
They're working 7 days a week, 10
Right.
hours a day.
Or they have the autonomy of being a practice owner and they're too stressed. And so
because they're following the money, they're chasing that money.
Exactly.
Mm-hmm.
And so for me, I ultimately want to be happy.
Okay.
And what does happiness look like for me? A certain amount of freedom.
Okay.
Freedom because I don't want to be working 6 days a week.
Sure.
I also don't want to have the stress of owning a bad practice.
Mm-hmm.
Of course, as you get along, you have different people you pull in, different coaches, different maybe accountants that you pull in, and they'll truly help ease your stress.
True.
And so right now, where do I want to go? I'm not sure yet because I still feel I'm not settled.
Mm-hmm.
I'm still kind of moving around. I don't plan on being here for the rest of my life. We'll see what happens, but that's not the plan.
Mm-hmm.
And so I don't really know where I want to be, but I want to be, first, I want to be happy. Second, I want to be comfortable.
Sure. Yeah, me as well. I just want to be happy, comfortable. Don't overwork yourself.
Right.
Don't just work for money.
That's true.
Work to help people. Yeah, you'll get paid. That's a byproduct.
Mm-hmm.
And just don't work 7 days a week. Live your life. Enjoy your time. Time is only here when you have it.
That is true. So I have a question for you.
Okay.
Why Tampa? Why Tampa? Why Florida? And I say that because you have no family there. You didn't grow up there.
Mm-hmm.
You might have a few friends there, but why Florida versus, say, Houston?
Okay. It's the palm trees. It's the iguanas. It's the clear water. That's the Gulf of Mexico water.
Right.
It's just beautiful water. The East Coast, I'm from New Jersey. That water is dirty. The East
Right.
Coast has the same dirty water, right?
Mm-hmm.
Unless you go all the way down by Miami and down by the Keys.
Right.
So yeah, just the weather, just the atmosphere.
Mm-hmm.
I don't know, just Clearwater, Florida.
Okay.
Just the sound of it just sounds nice. You could live by a spring, natural spring. You could live by the beach.
Exactly.
You could live a little bit more inland. Now, I will say one thing though. I'm scared of the hurricanes. I'm scared. I don't know how that area does with hurricanes. So that's something I have to look into because imagine you build your whole life and then boom.
So back to dentistry. You want to move to Florida. You've never lived there.
Never lived there.
Do you have any friends in Florida?
I have a few classmates. I have a few friends in Florida.
Okay.
I've only spent like 10 days of my entire life in Florida.
Got it.
Literally, that's it.
So you're going to establish a life. And what kind of dentistry do you want to establish?
So initially, I want to go into corporate dentistry.
Okay.
Just because I don't know any private practices in Florida because I'm not from Florida. If it was Jersey, it'd be a different ball game.
Exactly.
Initially, go there, make some money, learn the area, see where I want to settle down, and then I'm gonna try to. You tell me if this is a good idea. Try to buy an existing practice. I don't want to build a practice from scratch.
Okay.
Not initially. Buy an existing practice, maybe 1, 2, or 3 at most.
Gotcha.
And ultimately, man, I kind of just want to step away. I don't want to do dentistry my whole life. Just because it's so physically demanding on your back, your shoulders, your eyes,
right,
your hands. So I don't want to do dentistry all the time for the rest of my life.
Okay.
Initially just to build your skill and hone in on the business aspect and the dentistry aspect. And then you want to just step back and just do it as you see fit.
I see.
What do you think of that plan?
I think that's an okay plan.
Okay.
Because it looks like your end goal is to be an owner of multiple practices.
Yeah, like 2 or 3.
Right. Okay. So for that, I maybe wouldn't go into corporate because corporate's not going to give you any business knowledge.
True.
They go there and they say, we're going to handle the business. We just want you to work. Exactly.
So, yeah, I kind of understand. That's why I don't want to stay in that field for too long.
Okay.
Probably just the first year or 2. 3 years max. And then I'm going to private practice.
Gotcha. And so the reason why I say it's an okay plan is because I feel that you would do better going private practice from the beginning.
So question for you, Doc.
Yes.
How would you go about getting into a private practice, not knowing the doctor?
Right. There are a couple. There's a lot of ways of doing it. A lot of different paths, and this kind of goes along with what we said at the beginning, where after you leave dental school, there is no map. Do it however you want. I know some people who will put out mailers. They'll get 400 envelopes, 400 letters, and send that to the different offices.
A bunch of offices.
Right. That's one way. Another way that people do it is they'll look up. You want to be in Clearwater? They'll look up all the dentists in Clearwater. They'll look up the jobs, or they'll look up to see how old the dentist is.
Interesting.
If the dentist is 60, 65, 70,
perfect.
They might be looking at selling soon.
Selling in a few years.
Right. And so for that, they'll try to get in with that dentist. At the first couple years, you probably won't make a lot of money. You probably you have the opportunity to learn a lot. And so what they'll do is you get in with that doctor who's 65. He'll show you a couple things. You'll learn the business side. The clinical side, it comes. They say 5 years out, and if all dentists are kind of equal.
Okay.
I could see that. Starting in private practice, learning the business side, to me that would be a better use of time, because in corporate, you're not going to know really anything about business. You're not going to know anything about billing, insurance, treatment planning. Sometimes you don't even know about, because you'll give them the treatment plan and then they'll go to a coordinator, and so that's, like I said, there's different avenues. You can take that avenue of going corporate, and that can work out very successfully for you.
Okay, so how about this? Let's talk dentistry specifically. What do you like and what don't you like about, which dental procedures do you run away from, and which ones do you prefer to do?
So I will say I don't have any experience in ortho.
Okay.
I simply don't. The school I went to was a great school, but we didn't have a ton of, ortho externships or internships.
Yes. For the people, ortho is...
Ortho is braces.
Braces, getting your teeth straightened. Either the wires or Invisalign or anything similar.
That is true, because in the medical profession, ortho is straightening your feet, and in the dental profession is straightening your teeth. Orthodontics.
Okay.
And so the procedures that I love taking out teeth.
Okay.
I love implants, placing them and restoring them, and I love kids.
Okay.
Because I find that people always say kids are innocent, but for me, kids are fun.
Yeah. They could be difficult.
They can be.
As a patient.
Sometimes, right? Yeah. Especially if they've had a poor dental experience previously.
Man, I've got a story for you, man.
Okay.
So I'm a 4th year dental student, as I said earlier. And about 2 weeks ago, I was on pediatric rotation, pediatric for kids.
Right.
And there was this adorable 9-year-old girl. She was in the other operatory, and her brother was in my operatory, and he was about 11. So this 9-year-old girl, she was in the seat, everything was fine. They were just doing a filling on her back tooth, and they had already given her the needle. She didn't even feel it. She was perfectly fine.
Right.
Some time went by, maybe 45 minutes, and they needed to give her more anesthetic, more of the needle.
Right.
So they made a mistake. My 2 classmates are working. She saw the needle.
Showing her the needle.
She saw the needle.
Right.
She jumped up from the seat. She was on the seat with her knee. She was like, "Why do you have that?" And then they try to hide it from her for about 30 minutes. Like, "No, we're not going to use it. This, and that." She said, she was like, "Don't lie to me. Why do you have that?" She's 9 years old. And then there was about 2 students and two pediatric dentists in there.
Okay.
And they really couldn't control her for the rest of it. Then her brother's over here, and he gets up. He's like, "What's wrong with my sister? I want to see my sister."
I know.
So they ended up not completing the treatment, but they placed the sealant on there.
Okay.
And then when they went for the acid etch, that's also a needle.
Looks like a needle.
It looks like a needle, but it's not gonna stick you.
It's not gonna hurt.
It's just a needle that deposits a blue liquid onto your tooth.
Right.
But she saw that, and then it was over. It was over. The appointment was over at that point.
Yes. That's funny. So I have a story for you then.
Okay.
I a private practice here in Nashville.
Okay.
I worked there for about a week to kind of cover for someone going on vacation, and so there you see a lot of kids. And like I said, I enjoy seeing kids.
Okay.
And that will happen. You try to have the needle kind of between your legs under their head so they can't see it. Mm-hmm. But every once in a while they'll turn this way, they'll turn that way, and they'll say, "What's that?"
What's that?
And so what I'll do is I take off the needle, the actual syringe. Mm-hmm. I take off the needle part and I give them the syringe. I'm like, "Oh, this is what it is."
Okay.
And so they're like touching it, holding it. And it's interesting because I find that kids, as long as they don't see the needle, they don't know what it is. Mm-hmm. And so I spin it because on the end of the syringe there is a ring.
Yeah.
And so I take it and I spin it around like this is what it's for, and I give it to them. And then after that I gave it back, and hopefully I hide it. I put the needle back on, there. And then as long as they don't see that, they're good.
Yeah.
And so that's kind of funny because she saw the syringe and
that's
the
actually
needle,
a good trick.
But if you take away the needle, then it's something new to them,
Yeah. That's actually a good trick because later on when they see just the part with the ring on it,
exactly,
the needle will be out of
sight.
Out of sight. They won't know what you're doing, and yeah, it doesn't hurt. It hurts a little bit. It's a little
generally
pinch,
doesn't hurt,
but it hurts more when they know it's a needle.
Exactly.
Exactly.
Thank you for watching Culturally Prescribed.
Like, comment, and subscribe down below, and we'll see you on the next one.
You guys are